Do liquid facelifts and non-surgical facelifts work?
Terms such as non-surgical facelift or liquid facelift are offered by many types of medical providers. These procedures are also offered by doctors who aren't trained to perform surgical facelifts, as well as also by surgeons who do perform surgical facelifts. The question is if these non-surgical procedures are effective and comparable to a surgical facelift. I've been performing surgical facelifts as well as other surgical procedures such as facial implant surgery for over 25 years. I also perform the treatments that some practitioners call non-surgical facelifts, such as skin tightening procedures and skin toning procedures with lasers, radiofrequency technology. I also perform a full range of injectable treatments that are performed in liquid facelifts, including neuromodulators such as Botox, as well as cosmetic fillers such as hyaluronic acid family, such as the Juvederm and Restylane. Lasers and radiofrequency procedures for skin tightening can help the skin retract as a response to heat. Laser treatments can also remove the top layers of skin, so a fresh layer of fresh skin comes in. Consumers are being manipulated to believe that they can get facelift results without surgery. This leads medical retailers who are not qualified to perform surgery to overtreat and literally cook the skin to appease their disappointed patients, unfortunately resulting in damage rather than improvement or making the skin ultimately look older. As mentioned earlier, I have non-surgical skin tightening technology in my office. I offer this type of treatment only to patients who are appropriate candidates, and I set realistic expectations. Neuromodulators like Botox or Jeuveau are considered by some practitioners to be a part of a liquid facelift. Neuromodulators can't be used to lift sagging cheeks and necks like a facelift. Neuromodulators can be used to relax muscles that contribute to downward movement of the eyebrows and the corners of the mouth. We routinely perform procedures such as Botox brow lift, lip lift, and lip flip. These services are offered with these precise descriptions as opposed to the nonspecific term liquid facelift. Early stages of facial aging is characterized by loss of volume, particularly at the bone level, as well as in the soft tissue, such as the fat layers and compartments. This loss of support creates a deflated appearance, making the skin appear to be sagging. In my practice, I routinely address facial volume loss non-surgically by working at the bone level using a technique called structural volumizing, using thicker hyaluronic acid fillers in a way comparable to the placement of facial implants. This differs significantly from traditional filler placement, which is just under the skin. The fillers are unable to maintain a shape initially created, resulting in migration and a stereotypical soft and doughy appearance. Bone-level placement of filler adds structure and definition to better support the overlying skin. The lift of structural volumizing is upward and outward. This procedure is not a substitute for facelift, but it does address another aspect of facial aging which is not addressed by surgical face and neck lift. In summary, most deceptively and aggressively non-surgical facelifts don't deliver what they claim to. Procedures such as structural volumizing can effectively create a perception of you having undergone a facelift by restoring projection in areas such as the cheekbones, the chin, and the jawline. Structural volumizing is typically appropriate for middle-aged men and women with minimal skin sagging. Additionally, younger people with genetic deficiencies in bone structure, such as a weak chin, as well as middle-aged to older people who've had facelift surgery in the past can also benefit from structural volumizing.